pregnancy consultation or confirmation? Or how are you seeing those patients right now? And what during what weeks do you recommend them coming in and reaching out to you?
So in general, we usually always tell people 8 weeks is the best time to come in because that's when the baby's large enough to actually be seen on an ultrasound and you can actually get a heart rate. Prior to that, it's more of just like a conversation. How are you feeling? What's going on? Are you taking your prenatal vitamins? Are you having any nausea, vomiting, things like that? And then outside of that, when they come in at the 8 weeks, like I said, they'll get their ultrasound and their initial blood work, and we kind of go from there.
And do you take blood work in your at your office right now?
We have an actual lab on the first floor in our building that we usually send people to.
Got it. Okay. Because I was wondering how I'm sort of past all of that blood work in my personal pregnancy right now. But I remember there was, a 6-week period where I was getting blood work every 2 weeks or so. And I was curious what that looked like and how you guys are managing that and send with patients right now in the climate.
Yeah, well, for any necessary blood work, we are definitely having people come in for those visits. But anything in the in between, the usual just, hey, checking in, how are you doing? How are you feeling? We're making all of those more phone visits. And then if during that visit they give us some type of inkling that something doesn't seem right or they maybe really need to come in, then we'll have them come in at the next available appointment, which now, since nobody's really coming in, could be the next day, later that day.
Right. I know. Nice. And we can actually, get in to see you guys.
I know.
Usually you're like,
oh, wait.
no, I need to see you in 3 hours. And you're like, well, in 3 weeks, we'll see you. From an availability standpoint, I've been there for sure.
Yeah.
Patients now that are coming in and having sort of the early misses or the miscarriages, how are you managing those conversations and managing that whole situation?
Well, we're still a little more conservative, so we're really encouraging more of like a medication type if people need help with the passing of any of the pregnancy.
Okay.
And most of the time, depending on how far along they are, so if they're definitely 8 weeks or less, then usually you can kind of manage that at home, but we still give them the same precautions. If your bleeding becomes too heavy to the point you're changing a pad every hour on the hour, lasting more than 3 hours, then absolutely you need to come in, because now that's becoming a quote unquote medical emergency and you need to be seen versus, oh, the bleeding seems kind of heavy, or oh, the cramping is a little bit, or oh, why don't you just come on in? We'll just do an ultrasound real quick and check you. Now it's like, okay, well, this is what I'm really looking for. This is what I need you to tell me. You can call me every hour on the hour and give me an update on like what your bleeding is doing, what's going on. We can talk, because now we have the luxury of being available. Because before I was like, we didn't have time, so just get in the office and when you get here, I'll see you and I'll do everything one-stop shop versus having these like constant conversations, with the patient over the phone. Even with the video chat, you can like be like, hey, this is what my blood actually looks like. This is what I passed. Like, this is what's going on, where before that wasn't an option.
And where would you sort of draw that line between spotting in that first trimester versus more of a early miscarriage or more of a concerning issue?
So I tell everybody, spotting, if it's pink, that's okay. If it's brown, that's okay. If it's so much that you have to actually put on a pad, that's not normal. That's something I need to know about, and you probably need to be seen. But with the current climate, I'd be like, okay, I need you to call me. We need to like monitor it. I need you to save, whatever you can, take pictures of whatever you can, and then do the virtual, like, okay, let me talk you through it. Let me tell you what's going on. If you need to go pick up a prescription to kind of help things along, if you're having a lot of pain, all the drive-through pharmacies that are available now, or at least down here.
Yeah.
These are your options so that we can continue to manage this without putting you at additional risk for, not only miscarriage, but then now coronavirus.
Right.